do call the meeting to order. And we already have Westwood Media Center recording this, and I suspect there would be no one else. I take that to be the case. So we go to the minutes, or do you want to read your thing?
Let me read the disclaimer. Are we live, Connor?
Yes, you guys are live and good to go.
Okay. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, Mass General Law, Chapter 30A, Section 18, and the Governor's March 23, 2020 emergency order imposing strict limitations on the number of people that may gather in one place, the Board of Health meeting will be conducted via remote participation by the board. The meeting will be live streamed by Westwood Media Center, and the public can view the meeting by accessing the link on YouTube. Our government channel will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via the Westwood Media Center live stream. The public will be allowed to make comments if they wish to do so during the portions of the meeting designated for public comment by using this says conference call number, but we're going to have people do the raise hand function. The chair will continue to give guidance and instruction as needed. Every effort will be made to ensure the public can adequately access the proceedings via technological means. In the event we are unable to do so, despite our best efforts, we will post on the town website, www.townhall.westwood.ma.us, an audio or video recording or transcript as soon as practicable after the meeting.
That sounds good. I'm sure Governor Baker would appreciate that. So we will check the minutes. I have reviewed them and found them to be in good order. Carol, you were there at the time.
They're fine with me, thank you.
So you accept the minutes?
I do.
Okay, and I, Roger Christian, accept the minutes of September 15, 2020 as well. Having done that, I guess it's time to introduce our new member of the Board of Health, that being Shelley Reever, who comes to us as a double threat in that she brings not only skills in the realm of the law, but also in medicine. And it's such a great pleasure to have you join us, Shelley. You've had a very interesting background, and I know you'll add a lot to the board itself. So do you want to say anything more about Shelley, Jared, or Carol? I have not met Shelley personally yet.
I just want to say I'm looking forward to working with everyone and participating on the board. Thanks very much.
Yeah. I've known Shelley for a long time, so I'm thrilled that she's joined the board. Yeah.
And I welcome you, Shelley. I'm pleased to have you, your guidance and your experience, like Roger said, in legal and medical arenas, and you will be an asset to us during this current pandemic and hopefully well beyond.
Very good. Thank you. And then our other new person being Margaret Sullivan. I did have the pleasure of meeting her when she came for an interview, and it was one of those in-person type interviews, and I was just delighted to meet her then. She also brings to us many skills, one of which is very important at this time, in that she has been schooled in contact tracing, but she's done a lot of public health work. And I suspect she's already been contributing to the board at this point. So welcome to you, Margaret, as well. I'm delighted that you have decided to join us. And Jared and Carol, do you want to add further comments?
No, I'm very happy that Margaret accepted the job, and she has a lot of great qualifications, so I'm happy
Thanks,
to have
Carol.
her also.
Yeah.
I'm happy to be here.
Good.
I'm extremely pleased that Margaret is now on our team. She brings a ton of experience and an enthusiasm, which we definitely need at this time because the energy, it takes a lot of energy to stay in this every day. And, we're already kind of starting to build a little bit of a rapport and a rhythm amongst the team, Lorraine and Jason and the two of us. So I say we're off to a great start.
Agreed. Right. Welcome, Margaret. Nice to meet you.
Thank you. You too, Shelley.
Jason, do you want to say anything, or Lorraine?
And welcome to both of you.
Yes, same. I'm happy to have you both on board. I'm looking forward to working with both of you guys.
Great.
Likewise.
Such a good team. Thank you. Moving on, I suspect you have a little report to give us.
Absolutely. Thank you, Roger. So let's start out with the recap. We held our flu clinic, our annual flu clinic in October. We partnered with Wegmans Pharmacy and Mary Wilkie and her team over there to provide an outdoor flu clinic by appointment. We were able to vaccinate 273 residents in the span of the 4 hours that we were there. The lines were very manageable. The residents who came seemed very pleased with the experience and the ability for them to easily access their flu shot in an outdoor setting with the Wegmans crew. You know, special thanks to everybody from that team who participated. They handled the customer service end with ease and grace, and they could not have been more professional and accommodating, and I was very pleased with how it all turned out. So I'm grateful that we were able to provide a clinic for residents in need, and many residents took advantage of it. So you know, how things shape up in the future obviously will you know, remain to be seen with other clinics or other types of outdoor you know, processes, and but now that we have one under our belt, you know, maybe we can replicate that in another venue down the road. The other big accommodation we made this in the last few months was Hale Reservation was granted a permit to operate a remote learning center. So in response to the need for childcare and school supervision, the governor's office in partnership with EEC provided a framework, whereas different agencies could apply for permits to operate. Basically, it's deemed a remote learning center, so it's sort of like a study hall where children can sign up and attend a supervised venue for the purposes of accessing their online learning during Zoom or Google Classroom or whatever they're doing, their schools are doing, for them to access their education that way. And for parents that need additional days of childcare, because their schools are in hybrid, they're able to sign up. So we inspected and approved that along with fire and building a few weeks ago, and it's been relatively smooth. We haven't had any real issues. So it's another resource for parents and kids who need a place, with supervision to be able to gather while they are in hybrid in the schools and the towns where they live. So that I thought was pretty quick turnaround given the short notice the state had given us. So on to COVID matters.
Barry, can I just ask you a quick question?
Sure, absolutely. Go ahead.
What about town employees getting the flu shot? Is there something set up for them?
We are in the process of acquiring additional vaccine from Sanofi, which will be distributed through the EMT paramedics with the fire department, and they'll be able to access a flu shot that way.
Okay.
Through a program that Chief Deckers initiated. The firefighter, paramedic, EMTs were all authorized to do vaccinations. So that'll be a resource. So the vaccine is on order. Obviously there's continuously shipping delays, but when the vaccine is received, we'll set up an appointment calendar similar to what we did last year. But instead of having people come to Carby, we'll probably send them to whatever's most convenient for the firefighter paramedics to get their flu shots that way. So there is something in the works. It'll probably be a few more weeks, but we cautioned the department heads not to tell their employees to wait, that people should get their flu shots when it's most convenient for them. so that they are able to, to have that taken care of and not wait for us just in case anything unusual happens.
Okay, thank you.
Okay. So we had some adjustments to some of the orders, the COVID orders that the governor had introduced earlier this month. So, one was an additional restriction on gatherings where indoor gatherings on private property were reduced to 10. Outdoor gatherings on private property was reduced to 25. The face mask, face covering order advisory was adjusted to include any outdoor public space, even if you can keep 6 feet of space between you and another person. And the idea really is to just encourage more consistent mask wearing and to sort of remove those opportunities where people kind of bump into each other, not expecting someone else to be there, and have your mask not at the ready. So this order will, require anybody in a public space to keep their face covering on. And the last one was the stay-at-home advisory, or that has limited the hours of some businesses, particularly the entertainment and dining venues. They're being asked to sort of cease service at 9:30 and have their premises cleared shortly thereafter. So they're between 10 p.m. and 5 a.m. I believe they're barred from customers being inside their venues. They're still allowed to be open for curbside, takeout, that type of thing, but there will be no indoor seating or indoor hosting of any customers after during those hours. So those hopefully can help. Question?
Yes. In the Globe 2 or 3 days ago, there was some mention that they, meaning the governor's office, might consider disbanding in restaurant dining for a while. Has there been any rumor that's come to you through that route?
No, I haven't heard anything concrete on that yet. We heard a murmur on our call today about reminding people on the guidance for what constitutes outdoor dining and using tents. So there may be some sort of maybe a hybrid between reducing capacity indoors but increasing capacity in a tent or an outdoor venue. So, but nothing concrete as of yet. The governor himself, I believe, said that he wouldn't likely not to introduce any new orders, but I guess that doesn't preclude him from revising existing orders. So I'm sure as the weather turns colder and darker, we might hear something. The hourly limit was probably the first attempt to kind of keep things tamped down a little bit, but nothing yet on that. So, if something comes down, I'm sure they'll notify us.
Thank you.
Yeah. And so townwide, town surveillance. So, it's clear for anybody who's paying attention that the country, the state, and the town all are seeing increases in case counts. We're no different. We had made our first venture into the red category, albeit for a short amount of time, because during that period they recalculated the metric on how towns are, sort of gauged in terms of their high risk, moderate risk, low risk for COVID. So for 1 week we were red, and our case counts were relatively higher than they were, although proportionally they still on average were slightly lower than a lot of other communities. So I think our residents are still doing a fairly good job of following the precautions. So once they recalculated the numbers, factoring in our population and our lower percent positivity testing rate, we were back in the green space for the previous 2 weeks. This week, I expect we might venture into yellow. We have had 3 clusters that have sort of covered, they kind of bookended weekly numbers. So the report that was released last week on Thursday night had us at 218 cases total. That was an increase of about 11, I think, from the week previous. Our testing positivity rate kind of stayed around 1.5. It kind of varied between like 1.3 and 1.6. 1,400 or so tests were issued that week. So we're definitely seeing testing increase. This week coming, our numbers are up again. I believe we had 21 cases that will be reported on this Thursday's weekly COVID report, and that added to the 11 that we had the previous week would give us a 14-day total of around 33, which would have us at about 16 or so cases per week, which would bump us up potentially into yellow, although our test positivity rate most likely will still be below 2. So I think we'll be on the edge there. But, regardless, like I said in one of my messages I sent to the community, regardless of our color-coded designation, what our goal is to make it as safe as possible here by, giving residents all the information they need to keep transmission of COVID to the lowest extent possible. So, that's where we're efforting every day through our contact tracing, through our educational and communication strategies, being accessible to the community by phone, by email, by any other means they want to contact us to have their questions or concerns answered. We're trying to return phone calls and emails, as soon as we're able, so that people get the answers that they need. They don't feel like we're not reachable or not accessible. We want very much for the community to know where we are and know how to find us should they have questions about their own or their family's COVID risk level, especially heading into the winter and into the holiday season. We're all preparing for what may be a severe increase in cases. Hopefully it doesn't come, but we have to be ready in case it does. With our tracing efforts here, local, and also our partnership with the CTC, we're going to tackle cases as they come and trace them out and try to isolate and quarantine as rapidly as we're able to. And, we're going to keep communicating to the community that, these are the steps you need to take to keep you and your family safe. Please make smart decisions as you gather, celebrate the holidays, as you hunker down for the winter. And that's the messaging. It hasn't changed much. We're putting out additional guidance for Thanksgiving travel. And if people go out of state, obviously they need to follow the travel advisory the governor has put forth, and how they will need to quarantine or produce a negative test. And we're hopeful that people do take that seriously, and we'll see a lower increase in cases than what's expected. So that would be townwide. I wanted to just take a minute to talk a little bit about school. Obviously, we did have an issue where the high school went into a fully remote capacity for a week due to a cluster that formed or was reported related to Halloween. So the superintendent of schools did convene, the COVID advisory council that she maintains to kind of go through the scenario of what we had seen and what we were expecting. So, we did all sort of agree that remote for a week to give that additional time for those cases to sort of play themselves out was appropriate. So that decision was made, and the school department resumed normal schedule this past Monday. And we had not seen any additional cases occur from that event. And we're monitoring, cases going forward to see if there are any connections to those original cases. But we're far enough along now that anything that's showing up in the database would be considered an unrelated event. So We're not seeing, I think it's important. I'm getting a lot of, you know, discussions coming to me from various members of the community that wants us to kind of talk about how we're not seeing transmission in school. That the age group, I tried to calculate it out. We've not including that, well, including cases that we have up to the minute or up to the day. We have 35 total for November so far, even though what will be reported next week will be a little bit lower because the reports lag. 10 of those were in the 19 and under group. And out of those 10, 8 of them were aged 14 to 18. So there is a significant portion of that demographic that may not be as closely adhering to the social distancing, face covering, gathering limits as maybe they should be. That age group tends to be fairly independent, so there isn't probably as much supervision from parents or other members of the family than there would be for the younger group. So we're seeing the case counts relatively low between like the kindergarten through 5th grade group, because they're kind of like supervised by an adult most of their day. The older kids are a little more free, and we're seeing a little bit more spread there among that cohort, but we're not able to tie it to school-based transmission, which is based on the 6 feet and the masking and all of those protocols that the school department had agreed to with DESE's guidance that came out over the summer. So happy to say that so far the inside of the school environment has been relatively, COVID transmission free. And that's a credit to, I think, the administration and the COVID team at the school, and the individual teachers, paras, and other adults in those buildings that are steadfast and rigorous in their enforcement and adherence to the protocols. So I just wanted that to be noted. So with that, I think that's everything that I had to say about COVID and where we are right now. I don't know if any of you on the board have questions particular to anything that I've said, or concerns.
Jared, I just wanted to ask one question about Thanksgiving gatherings.
Mhm.
I haven't seen anything, but is there any guidance about the visitors from out of state coming to Massachusetts?
It's covered under the Massachusetts travel regulation that was put out. It's been out for a while. So anyone coming in from a non-low risk state needs to follow the guideline there's different, sort of iterations of depending on where you're coming from and how long you're staying. But people who are coming in, from out of state need to fill out the form and register their, participation with the DPH web. There's like an app. I think people would sign up for that, and then they're asked to quarantine or provide a test, or that kind of plays out individually. So that's basically the framework that's going to be used, as far as I know, for the upcoming holiday. And conversely, for Massachusetts residents who plan to leave Massachusetts to travel elsewhere and then return to Massachusetts, there are similar requirements that they isolate, quarantine, and or test negative for COVID upon their return to their residence. So that it's the same guideline that's been in place since the summer travel season. The only difference is now probably like 46 states are considered non-low risk. So chances are anywhere you go, there is a requirement of a quarantine and or COVID test upon reentry.
Okay, thank you.
Mm-hmm. Right.
Well, having heard all of that, we have questions that people have posted. Do you have any there, Jason or Jared?
Connor would have anyone in the queue.
So if anybody would like to speak out loud, they can certainly raise their hands and I can unmute them. You do have one question in the Q&A section. So if you just want to click down there, there is one question there.
Okay. Is it under the jurisdiction of the Board of Health? And if so, is the Board of Health following up with businesses, if employees of businesses in Westwood do contract COVID, to ensure that within the businesses, employees are wearing masks, are able to isolate for 10 to 14 days, i.e. get necessary sick time, and are being tested at appropriate times? Okay, so we are following up on cases that are brought to our attention by the employer or through the town where the resident, where the employee resides. So all COVID-19 cases originate in the town where a resident of Massachusetts resides. And through the contact tracing, which is then led by that town's health department, they're able to determine what contacts or close contacts are viable for that individual case. And then from there, they reach out to us locally to inform us that, hey, a employee at XYZ has tested positive for Corona. This is the person, this is when they worked, this is the last day they were on shift, et cetera, et cetera. And then we take that information and take it to the individual businesses to make sure that employees are isolating and quarantining if they were close contacts of positive cases while at work. So that's the first part. The second part, so we do the contact tracing for our own residents, and then any employees who come in, we pick up from the locals. And mask enforcement is done on a complaint basis. Mostly community is able to call and let us know that wherever they're frequenting, the employees are non-compliant. So we send out our steadfast inspector, Jason Beaumonte, to conduct a complaint investigation, or myself if I'm in the neighborhood to conduct a complaint investigation. We educate and warn businesses primarily that they need to be in compliance, and then it escalates from there, where we can issue fines up to $300 per violation per day for noncompliance. We can also refer them to the board for a hearing if the enforcement doesn't improve, and the compliance rather doesn't improve through our normal means of regulatory control. So I hope that answers your question. Why is Westwood Board of Health not posting number of deaths per week cumulatively? I believe we covered that in the last meeting. I think the issue with this is there's not this information. From what we get in Maven reporting, is not always accurate. There is a lot of COVID case sort of leakage where cases are lost through follow-up at a certain point, and they're not always reported back if there's a related fatality. We see if it is in the system where Maven has has identified the person has passed away, we do get a note in the case line, but it's not reported out as a specific number, and it becomes really murky to try to report that number with any real accuracy. So we sort of have shied away from that type of number, focusing on the others. So I know it's probably not the answer people are looking for who are looking for that information, but I just feel like the number is just not reliable. And to give it would give a false sense of angst or a false sense of security to the person who observes that number for what we are able to see on the Maven report. Okay. Those two. If we have any others or any follow-ups.
I do not see any at this time on my end.
Okay. All right. Well, if anyone else is out there and they have other questions, you can reach me at my line at the office or email me too. And we're happy to respond that way if you'd like to have a one-on-one chat about anything involving public health, not just COVID. It's always nice to get a non-COVID related question.
Well, hearing all of that, shall we consider adjourning?
All right. Well, I'd like to wish everyone a happy Thanksgiving before that and a safe Thanksgiving.
And Thanksgiving to everyone. Have a happy Thanksgiving to everyone else. Stay safe.
All right.
Do I hear a motion for adjournment?
No, I second it.
All those in favor say aye.
Aye.
So Carol, you've said aye. Shelley, you've said aye. And I say aye as well. So thank you, everyone, for meeting. And we'll meet again at the appointed time that Jared will let us know. Thank you.
Thank you, everybody.
Night.
Bye, everyone.